You might be somebody that suffers from upper back pain and neck pain. Maybe that pain goes out into the top of your shoulders or down inside your shoulder blade, and you're wondering what a trip to the chiropractic office would be like. So today I'm going to show you exactly what we do for these tough cases in our office. Hi, I'm Dr. Putney from Wellington Family Chiropractic, and today I'm going to show you a treatment on our patient Jacob for upper back and neck tension that spreads out into the shoulder blades and the upper back. So with Jacob, we've obviously already done an exam, and on day one we found that his motion was very limited between his shoulder blades in the direction really of rotation, but especially extension, which is this forward movement of his upper back. He gets very stiff between his shoulder blades. And then at the base of his neck, where his cervical spine or his neck transitions into his upper back or his T-spine, he gets very locked up there too. And this just creates a lot of tension and pain for Jacob in different activities throughout the day. So what I'm going to show you first is the muscle work we do on him first, and then I'll show you the adjustment. So for Jacob, what we did was a process called ART, which is active release. And essentially what we're going to do is we're going to get on those stubborn muscles. And typically what I'll do for patients is I'll show them the range of motion I want them to go through. And we might do that a couple times together. And then I'll have him continue that as I hold that position around the shoulder blade, just near the top. And we'll do that until we feel that muscle release. It doesn't take long with this technique. And then for him, he was also very tight across the top border of his shoulder blade into the base of his head. And so we'll work using the same technique there. So I'll show him the position I want him to go through, the range. And once he's got that down, I'm going to let go and let him do it and just anchor in and work through that tough tissue where he carries a lot of tension. So typically we'll do this for, a couple minutes just to get those areas to calm down. And then we're going to adjust those areas that we talked about. So we'll do one more here. And then I'm going to have Jacob lay on his back. So again, we're going to be working through Jacob's upper T-spine or thoracic spine between his shoulder blades in the direction of extension where he is limited. So for this exercise, or for this adjustment, I'm going to have you scoot down just a little bit. I'm going to have him cross his arms. And then what I'm going to do is I'm going to use my arm to kind of create some compression. I'm going to roll him to the side. And then I'm going to slide my hand right back where we felt that he was most restricted and drop just like that. So you might have been able to hear that, but we got a big release in the direction where he was restricted. So from there, he just relaxes, and we're going to go through and feel these different areas of his neck. So again, like I talked about, he typically gets very locked up towards the base of his neck, and as I go through and I move those joints, I can feel a lot of restriction in this joint here. And this is very important. We don't just grab the neck and start popping. We want to go to the biggest restriction of movement that we can find. And for him, he's got one here. The biggest one first, though, is this one on the right. So that would be the vertebra or the joint that I'm going to adjust first. And for him, it's just going to be a quick, we're going to move him over and then go right through that restricted range of motion. Good. Just a little pop, but it's enough if we recheck. Much smoother range of motion. We'll recheck the other side. Still restricted through here. Again, we get to the point where he's the stiffest. And just a little thrust through there. And that has opened up that range of motion. And we'll recheck one more time to make sure we've got them all. And now, as I go through, he's moving great. So it's a quick, easy adjustment. Nothing too crazy, but it creates a lot of change in a short amount of time. If you're somebody that suffers from upper back pain or neck pain and you would like to be checked out in our office, just give us a call at 859-309-1996 or visit our website at wellchiropractic.com. We're always here to help, and we'll talk to you soon.